Okay, and if you guys need to run the bathroom or whatever, just run to the bathroom and then make sure you're back, within a reasonable amount of time. Okay, are you guys able to see my screen now? I've hit start, so it should pop up here with the pen in just a second. Okay, and remember with us doing cahoots for class that you guys need to be on here with me, please. Okay, a few more of you guys need to join and then we'll get started, okay? Okay. Okay, we're gonna go ahead and get started. Okay, so remember, chapter 21 is your week 4 material, okay? Okay, which child would have the most difficulty in coping with separation from parents? A 16-month-old child, a 4-year-old child, a 3-month-old child, or a 7-year-old child? $16-month-old child. Okay, that's because they're in early toddlerhood, right? And they're already in the stranger danger kind of phase, anyways, which is age appropriate at that age group. Okay, so out of those options, they're going to be the ones that care the most about their parents being there. An infant, they're not going to care so much as long as their needs are still being met by somebody, right? They're still being fed and changed and swaddled and cuddled by the nurse. So that's not going to be as detrimental to them compared to a toddler. Okay. Okay. How can we decrease the stress and anxiety of a 2-year-old that is hospitalized? Keep toddlers home schedule, keep the child occupied with activities, attend the playroom, or limit visitors. What do toddlers benefit from and like? Yep, keep their home schedule. Remember, toddlers enjoy their home schedule. Makes them feel more comfortable if they're able to abide by that. And they ideally want their parents there. Good. Okay, dramatic play has the child draw a picture about a scary hospital procedures. Why? Distracts the child from thinking about the scary procedure, provides a way for the child to express their feelings, provides a way to play quietly, or gives the child power to tell on the person that hurt them. Okay. Yeah, it provides a way for them to express their feelings and kind of what they're scared about. So that way you as a nurse can kind of talk them through what they're thinking. Good. Okay, a 2-year-old child has been crying constantly for his mother since he was hospitalized 3 days ago. This behavior, question mark. The toddler feels abandoned by his mother. The toddler still has not adjusted to his hospitalization. There is poor mother-child bond, or the child is not separated from his mother often. So yes, he's in separation anxiety stage, right? And since it's been 3 days, mom hasn't been there. He's getting to the point where he's feeling like mom's never coming back or abandoned. Okay. Good. Okay, which statement best corresponds to a preschooler's understanding of hospitalization? Preschooler, so this is 3 to 5-year-olds, okay? I have a cast because I broke my leg. My tonsils are sitting at the door right now. My tonsils are sick. Oh, hey, Federica, you're unmuted. Okay, my tonsils are sick and they have to come out. A germ made me get sick, or I got sick because I was mad at my brother. Remember, preschoolers think that their sickness is from punishment or a form of punishment, okay? So they'll think that something happened to them or they were hospitalized because of something that they did that was maybe naughty, okay? You guys have any questions during these, just unmute. Okay, the toddler seems more interested in her toys than the parents. Which stage of separation anxiety? Denial, attachment, despair, or protest? Denial, okay? That's because she's gone through abandonment and all of that. She's in the denial phase. Okay. Okay. Which roommate would be most appropriate for a 16-year-old adolescent with cystic fibrosis? A 15-year-old adolescent with type 1 diabetes mellitus, a 10-year-old child with sickle cell disease and vaso-occlusive crisis, to assign the adolescent to a private room, or a 4-year-old who had an appendectomy. So, cystic fibrosis kids, you get concerned about infection, right? Infection potentially from others. So you wouldn't want to put them with somebody who is sick for sure. A 10-year-old child is probably a little bit too young, and also that child has sickle cell disease. So if a kiddo with cystic fibrosis is in the hospital, it's not unlikely that they probably have some sort of, respiratory illness that's causing the worsening of their cystic fibrosis. So once again, with sickle cell kids, you don't want them to get sick. So those kids would not be a good combo. The adolescent, that's 15, so close age group, right, to the 16-year-old, and also has type 1 diabetes, which is also a chronic disease like cystic fibrosis. That would be the most appropriate if you had to assign roommates. Most children's hospitals these days do not assign roommates unless it's very like high patient population. Okay. Okay. Parents of a hospitalized 9-month-old infant ask if their preschool child may visit their younger sibling. Preschooler needs to visit to reassure himself that she is all right. Preschool children can be disruptive. The sibling could view the infant from the doorway, or seeing his younger sibling would probably be frightening. So think about a preschool child. Yeah, good. Allowing them reassurance by allowing them to see their sibling and see that they're doing okay. Yep, good. Okay, hospitalized toddler was drinking from a cup at home, but now refuses to drink from anything but their favorite bottle. He's exhibiting normal behavior for this age. He's refocusing the attention of the adults to avoid painful procedures. He's demonstrating attention-seeking behaviors, or he's dealing with the anxiety of hospitalization by regressing. Yes, regression, right? So that's a fairly normal thing in kiddos that are hospitalized, just to reassure parents that's a normal thing. And when he's through that hospitalization and at home, that should no longer be occurring. Okay, good. Okay, multi-select. Nurse encourages a school-age child to draw a picture after a painful procedure. Why? Encouraging quiet play, providing a way for the child to express their feelings, distracting the child from thinking about the pain, or attempting to reestablish a rapport. Yes, providing them a way to express their feelings and distracting the child from the pain. Allowing them to draw a picture after a painful procedure, it's not necessarily going to reestablish your rapport. What's going to help with that is you guys reassuring them that, that part of the painful procedure is over and you will not be hurting them any longer. Okay. Okay. When is the best time to begin to prepare a 5-year-old child for surgery and hospitalization? About 4 days before surgery, as soon as the surgery is scheduled, on the night before the admission to the hospital, or about 2 weeks before surgery. So preschool age kiddo. About 4 days before the procedure or before the surgery. So that way they have time to prepare. You have time for parents to kind of work with them on it, and it's not just something that they're told, the night before or the morning of. Sometimes parents will wait until then, and it's not very fair to them. Okay, a 13-year-old girl has been hospitalized for the past week. What is the girl's biggest concern? Appearance, separation from her boyfriend, loss of control, or invasive procedures. Think about adolescence development. Appearance. Adolescents care about their appearance, and if they're in the hospital, they're really going to care about their appearance. Okay. Good. Okay, the nurse notices the mother of a child with CP redoes many of the things that the nurse does. Response to the mother. I'm doing the very best job that I can with your child. Go have coffee. You're exhausted and you need to take a break. Would you like to do all of your child's care? I would love to share for you to share with me special things that you do for your child. Yes, good. A last response. Get that parent's feedback. They're the ones that at home are taking care of these chronically disabled kids. So a kiddo with cerebral palsy. Okay. And get that input from that parent. Okay. My toddler, cries when I visit. Maybe I should stay away. What's the nurse's best response? It might be easier if you stay with him. This decision is yours. This is a common reaction when they're separated from their parents. Perhaps you are right. He only gets upset when you leave. We take good care of him and he seems fine when you're not here. Yeah, it's a common reaction from when they're separated from parents. Good.
So, Ms. Becker, I have a question. Why wouldn't you say red? Because it would be easier if they stayed, the baby would get used to the parent being there.
Yes. Yeah. So, I mean, essentially reassuring parents that it's not uncommon for their child to be like worked up when they're there. And then that's a part of the hospitalization process. So that's kind of what that question was looking at. Not that that's not a correct response as well, but with them saying maybe I should just stay away, you should just reassure that parent that it's not their fault. That's just kind of the process of when a toddler's hospitalized, they're going through the separation anxiety steps. Does that make sense?
It does. Thank you.
Yep, you're welcome. Okay, preparing to collect an admission history from parents who have recently immigrated from Russia. Keep in mind what? Smiling is inappropriate in a serious situation. Staring is a sign of the nurse's rudeness. Touching the child's head means the nurse is superior. Eye to eye contact is considered disrespectful. Smiling is inappropriate in a serious situation. Yep. So that's kind of a cultural thing to be aware of. There's if there's concern or if you can tell, potentially with each admission, you should be asking if there's any fairly soon when you're getting that kiddo in. You should be asking if there's any cultural or beliefs that they have that they want you to be aware of when you're caring for their child. And in asking that, they can a lot of times help you guys out in, not having to assume that there might be some cultural differences or doing something that they may feel is disrespectful or inappropriate. Okay. And you guys should do that with your adult patients too. Ask them if they have any cultural or religious beliefs, things like that, that they want you to be aware of. Good. And remember, we have to stay in class until 10:25, since we're till, 11:25. Okay. Which nursing action would facilitate rapport with the child and the child's parents during the admission process? Answer questions in a calm, matter-of-fact way. Perform assessments and ask questions as quickly as possible. Express concern about the seriousness of the child's condition and direct parents to undress the child. Yes. Answer their questions in a calm and matter-of-fact way. Okay. Okay, a 4-year-old child begins to cry when his mother tells him it is time for his operation. Which particular fear is this? Restricted mobility, unfamiliar routines, loss of control, or invasive procedures? So, invasive procedures, right? A 4-year-old, they're scared about what's going to happen to them. Okay. How does a preschooler understand the reason for being hospitalized? I got a cast because I broke my arm. My appendix got sick because I hit my sister. My ear hurts and I need medicine. A germ made me sick. My appendix got sick because I hit my sister. Remember, preschoolers are going to think that they're hospitalized because of something that they did. Okay. Okay. What age child has the most difficulty in coping with separation from parents when hospitalized? 6-month-old, 4-year-old, 18-month-old, or an 8-year-old? Eighteen-month-old. Good. Yep, those toddlers. Good. Okay, how do you know that the parent understands a hospitalized toddler's need for transitional objects? This stuffed animal makes him feel secure. I'd like to give him some toys from the playroom. He insisted on bringing this old dirty blanket with him. I'm going to buy him a big stuffed animal from the gift shop. What will help with the transition while they're hospitalized? Yep, the stuffed animal makes him feel secure. Yep. And, if his dirty blanket was his security item, that would be okay too. Ideally, if we could get it washed before, but that's fine. Something that makes them feel secure, along with having parents there. And toddlerhood is important. Okay. How would you tell a toddler or a preschooler when daddy is coming to visit so that they understand? Show them a clock and point to the time. After your lunch is your daddy is coming. Daddy will be here at 4:00. Daddy will be here in about 2 hours. Think of a preschooler's development. Yes. They understand not really timing, but in their schedule throughout the day, if they have a consistent routine and a consistent schedule, you can talk with them about after lunch or after your nap or something like that. Okay. Good. What advantage of fentanyl for upcoming procedure will the nurse explain? It has rapid onset. It has a long duration. It is specifically designed for children. It is not addicting. What would be your education on using fentanyl? It has a rapid onset. Yep. It does not have a long duration. It has a very short duration, actually. That's why you can push it fairly frequent. And then it's not specifically designed for children. It's used across all age groups, and it is addicting, can be. Okay. Okay, the nurse shares the information and timelines recorded on the interdisciplinary outline of care. What is this document? A holistic care approach, a comprehensive nursing plan, a clinical pathway, or incorporated cost analysis? A clinical pathway, because it was the interdisciplinary outline of care, not just the nursing care. Okay. Good. Okay, multi-select. What is the name of an adolescent that has legal rights to sign their own consents? Healthcare guardian, emancipated minor, legal guardian, cognitively aware 18-year-old male. Emancipated minor and a cognitively aware 18-year-old male. Yep. Good. Good. Any questions on that one? No.
Yeah, I do. Is that a specific terminology, the cognitively aware? Because somebody can be cognitively aware as in they're not like disabled.
So yeah, that's saying essentially that they're with it and not like mentally handicapped or have a cognitive impairment and they're 18. So if they were 18 and they had a cognitive impairment, that would not be someone who could legally sign their own consents.
I got it. Thank you.
Yep, you're welcome. Oh, come on, computer. It's going slow today. Okay, the nurse is preparing to start an IV on an infant admitted to the pediatric unit. What intervention is appropriate? Let the child examine the equipment, provide a simple explanation to the child, suggest coping techniques, or involve the parents. Remember, infants. Yes, involve the parents. Yep. Infants, you don't need to let them examine the equipment because they won't necessarily care or understand what's going on. Okay. So involve the parents in the IV start process. As long as they want to be involved. There are some parents that will not want to be involved in an IV start process on their baby. So if that's the case, then you just will need extra nursing help. Okay, multi-select. What are the stages of separation anxiety? Denial, protest, despair, acceptance. Yes, good. Denial, protest, despair. You guys remember the other one? It's not acceptance. Abandonment, right? Good. Okay, another multi-select. What will the nurse include when documenting the discharge of a pediatric patient? Adults accompanying the child in the relationship to the adult, method of transportation, the condition of the child, that instructions were given to the physician, time of discharge, and written discharge instructions were given to parents. Which ones all apply? Yes, so adults who are accompanying that child and their relationship, you want to make sure you chart that because, you know, if there's an adult there that's accompanying the child that does not have like a close or legal guardianship role, then that child should not be going home with that person unless you have verbal consent from the parents. How they're being transported, so how they're leaving the hospital, okay? The condition of the child prior to leaving. You also, a lot of times there's a protocol at children's hospitals or at most hospitals that you have to get a set of discharge vitals within a certain amount of time before they leave and do a discharge assessment. So that should be included. The time that they're actually leaving, and then that you provided written discharge instructions and verbal discharge instructions, and that you gave those to the parents or legal guardian. Okay. Any questions on that one? No? Okay. Okay, another multi-select. What are the basic fears of a young child being hospitalized? Body intrusion, separation, cost, or pain? And this was select all that apply. Yes, good. They don't care about cost, usually young children. Now, adolescents, if they know parent situations, they may care about the cost of the hospitalization and feel bad about that. Okay, or older school age kids, they may feel the same. Body intrusion, that means, you know, you're intruding in their space and with their body, so they're not thrilled about that as young school age kids. Separation from their parents and their friends and their school and their teachers, that's all a part of it. And then obviously the pain that they may experience while they're hospitalized. Okay, last one here. It's another multi-select. What nursing care would you incorporate when caring for a toddler? Therapeutic care, keeping the toddler in their room, be flexible, use soothing techniques when teaching about scary experiences. Yes, so therapeutic care, be flexible, because toddlers are inflexible themselves by nature. So you have to work with them because a lot of times they're even more inflexible than they are at home when they're in the hospital because they're scared. And then, yeah, using soothing techniques when teaching about scary experiences. So for toddlers, what's something you could do that would be a soothing technique in trying to teach them about something that might be happening?
Have their favorite toy.
Yeah. Mm-hmm. Sorry,
I
it's hard
have,
to hear ya.
I have a question.
Uh-huh.
What is therapeutic care? What do you intend?
Like therapeutic care. So that means giving them their space, like respecting their privacy, being therapeutic, like communicating with them in a kind way that they understand, getting down on their level. And that's a term you've read in your book from this chapter. Okay. What else is something you could do for a toddler that's soothing?
Like make sure they have their favorite toy, like stuffed animal or blanket with them, if possible.
Mm-hmm. Could you also let them play with your equipment, like as long as it's not something sharp or something that they could get hurt with, right? I kind of experiment with it, realize
Good
that
idea.
it's, yep, realize that, you know, the otoscope or the your stethoscope isn't going to hurt them when it touches them. Okay. Or do your assessment on their stuffed animal first. Okay. Things like that. That's all a part of therapeutic care too. Okay. I'm going to stop sharing my screen. What about some things that you could do to explain a procedure to an adolescent?
Use terms like they understand, like break it down to them in terms they will understand.
Yeah. Good. Allow them to ask questions. Maybe they're a kid that's in the hospital a lot with like something like type 1 diabetes or cystic fibrosis or sickle cell. So they've been hospitalized a lot. And, you know, maybe they want to take their blood sugar. Maybe they want to do something their self because they know how to do it. So something that you can just kind of supervise them doing in adolescence. Okay. All right, I'm going to pull up the PowerPoint. Does anyone have anything else? So next week there will be a quiz. It will be over this week's material. Okay. So chapter 21. You have a study guide in your announcements.
Just chapter 21 or 22 too?
For your week, your material that was this week. So it's chapter 21 and sorry, it's loading here. Yeah, so it's chapter 21. And then like think about your mandatory reporting for abuse and legal issues. So that's kind of all encompassing on chapter 21. Okay. When you guys get your exam grades back on Saturday, if you are concerned or shocked, or if you want to go over concepts from the exam, you can send me a message and we can set up a time to do that. Okay. Yes, so only chapter 21 for next week. That's your week 4 material. Okay. Sorry, this PowerPoint was pulled up. It's taking forever. So if you want a meeting with me to go over exam concepts, we can't go over questions specifically. but we can go over concepts. You send me an email, okay? And we'll set up a time. Okay. I'm gonna go. Okay. You should be able to see my screen again. Hopefully. You see the PowerPoint? We'll do this for the last few minutes, okay? So there's your objectives for chapter 21, things that you should know all the keywords, the phases of separation anxiety, all of that, okay? So hospital care settings. So healthcare can be delivered in different settings. So you can have acute care in the hospital, can be, an ER visit. It could be an urgent care visit. It could be a clinic, like a routine well child visit. Or, they could be in a research center, having like a research study done, or they could be at home. Okay. And you could be in home care for pediatric nursing. So in all of those settings, you guys will need to know how to care for pediatric population patients in these different settings. The techniques will be all very similar. It'll just be kind of based on the kiddo's age and development. Okay. So infants, you're going to involve the parents. You're going to have a familiar object around. Okay. And you're going to try and distract them and soothe them. So something for infants for soothing can be sweeties is what it's called. It's almost like a sugar water. And you can give that with their pacifier. So just a couple drops and then put the pacifier in. And they've actually done studies that the sweeties is equivalent to giving that baby morphine for pain management, which sounds crazy, I know, but so that's one way. So if you're going to do an IV in a baby or a blood draw or something like that, that's one way that you could distract them and help reduce their pain without having to do like a narcotic or something. Toddlers and preschoolers, once again, you're going to involve the parents. You're going to simply explain things in a way that they can understand, but also that the parents can help to explain what's going to go on. You want to give them permission to say that, they're scared or they're uncomfortable or they're nervous. And then also try to redirect that and distract them in some way. Okay. If you can give them choices, but of course, if they need a IV place or they need a vaccine or something like that, they're going to choose to not have that, but that's not a choice. So, in those situations, you can't necessarily give them choices, but you could give them a choice between, do we do your IV first, or do you want us to do this first? Okay. School age kiddos, you're going to do all of the things that you did with the preschool age kids and toddler age kids. And then you also let them play with the equipment. Obviously not sharp things or something that they could get hurt on. But with your otoscope, your ophthalmoscope, your stethoscope, all of those things that they can play with. Encourage them to verbalize their fears and then offer a reward. Maybe like they get to go to the treasure chest after they have a procedure done, or they get a sticker or a book. Okay. For adolescents are going to be the kids that want privacy, right? They want to be left alone as much as possible, but they also want to be involved in their treatment. So make sure that they are aware, that you're bound by confidentiality, and so that you will keep things private. if you're having to do an exam and look at their skin really good everywhere, make sure you're keeping areas covered up that you're not looking at. Okay. And then explain the procedure or the treatment that they're going to be receiving, and then giving them some coping skills. Okay. So like, watching TV or playing on their phone could be some coping skills for adolescents. Okay. Okay. So the child's reaction to hospitalization obviously depends on their age. Okay. And also how they're prepared. So if kids are not prepared for the hospitalization, even if they're adolescents, they're going to struggle with adjusting to that. Okay. If they've had previous hospitalizations, they may already have some kind of preconceived things that may happen, that you have to kind of put those fears to rest as well. Okay. Support that child's emotional health in any way that you can, whether it's with using the parents, for care support, or you as a nurse comforting that child. Okay. Stressors for all kids, even though adolescents don't act like it bothers them for their parents to not be there, a lot of times that still is a bothersome thing to them. Okay. So separation from their parents or their caregivers, obviously pain, and then fear of intrusions on their body. Okay. I'll keep going here if you guys want to stay on. Otherwise, you are okay to get off now. Okay. Separation anxiety. So this occurs in infants 6 months and older. Okay. So it doesn't start prior to 6 months. There's the 3 stages. So protest and toddlers, usually they're going to watch and listen for their parents. They're going to cry continuously until they fall asleep from exhaustion. They may also like yell for their parent or repeatedly try to get their attention. And they've had to, go back to work or something while the kiddo's being hospitalized. Okay. Strangers approaching them when they're, calling for their mom or their dad, that only increases the screaming typically. Despair, so that's crying until it eventually stops. Okay. Child may become depressed or withdrawn, and they are not actively playing with their toys. Denial or detachment, so they deny the need for their parent, or they're detached from their parent, or they're getting to the point where they feel like they're abandoned. Okay. They're more interested in their toys and their playmates and their surroundings. Okay. So this can kind of be a form of a coping mechanism for some kids. Okay. Is to detach, to try to reduce the pain emotionally. Okay. Fear, intrusive procedures. Obviously, that's something that causes fear in a lot of kiddos. It disrupts the child's trust, especially if that fear isn't addressed in a way that they're able to cope or understand the fear prior to it happening. So like the procedure isn't explained. A lot of times it threatens their sense of self-control and their overall self-esteem. So sticking to their familiar schedules and rituals and routines at home that they do or in the school setting as much as you can will help you nursing wise. Regression, remember we talked about this. This is a normal behavior that happens. So reassuring parents that when these kiddos go home, they should return to their prior developmental status. Okay. So they may have been totally potty trained. They go to the hospital and potty training goes out the window. Okay. So we already talked about that. Okay, here's a critical thinking one. We'll end on this, okay? So you guys can just unmute The parent of a 2-year-old patient says that she's decided not to visit for the next couple of days because it upsets her daughter too much when she has to leave. She says it will be easier on everyone if she stays away until it is time for her daughter to be discharged. How should the nurse respond to this?
That her daughter's going through a normal reaction.
Mhm.
It's not unnormal for that to happen, and she should visit.
Yeah, and that it's not her fault, right?
Mhm.
Yeah, yeah, yeah. That she would do better if parents stay there and can kind of be familiar, but that's a part of the process, unfortunately, for toddlers who are hospitalized. Yep, good. Anyone else have any other input on that? No? Oh, you got muted.
I was just thinking it would be helpful to add that she would come after meal times, or, you know, a time to kind of help her. Oh, I'll see you after lunch or something like that.
Yeah, yeah, especially if she has to leave for a little bit for work or something like that. Yeah, yep, good. Yeah. Anything else? No? Alrighty, study hard for your quiz next week. If you guys need anything from me before you hop off, just stay on here and we can chat. But other than that, if you want to have a meeting with me to go over exam concepts, just send me an email. I'll probably try to set that up for, after class next Monday, if that would work for you guys. And we can just meet individually. So we'll set up times. That way, we're not having to go over concepts with a bunch of people if people struggled on their exams. Okay. So just send me an email. Okay.
Thank you.
Thank you.
Yep. You're welcome. Have a good day, guys.